Hi, my name is Kerry Noonan, and I'm really glad to welcome Simon Chapman and Rachel Zammit to the conversation today. We're going to be talking about public health and palliative care, but in particular about some of the work that they're doing in the UK and in relation to the Public Health and Palliative Care Conference that is coming up in Bristol in May. So, hello.
Hello. Hi Kerry, hi Simon. Yes, my name is Rachel Zammit and I am Head of Public Health and Wellbeing for the End of Life Partnership, which is a charitable collaborative in Cheshire.
Hi Kerry, hi Rachel, hello everybody. My name is Simon Chapman. I work at the National Council for Palliative Care in England, and we are the umbrella charity that promotes good palliative and end-of-life care in England, Wales and Northern Ireland. And we also lead Dying Matters, which is a public awareness campaign designed really to get people to think and behave differently around dying, death and bereavement.
What does public health and palliative care mean to you, and how does it influence your work?
What's really important in the public health and participatory approach and building community resilience is this recognition that dying, death and bereavement do have medical and health components, but it's not all about that. And it's about recognising that we've all got a role and a responsibility and a part to play in this, in supporting each other at times of crisis and loss, and making sure that we can help each other and support each other through this inevitable experience.
When we're looking at ageing and death and dying as a public health issue, then we can see that it affects health and well-being in so many ways. So whether it's getting older, disability, bereavement, care and responsibility. And so that's really just emphasises how important it is that we all work together to do this and to tackle these issues. And the only way that we will do that is by working in partnership with organisations, but with the public and with our communities.
So, Rachel, could you give us an example of the work that you're doing on the ground? And Simon, could you talk about the work that you do and how the grassroots initiatives that are happening in the UK relates to Dying Matters?
Our work really centres around a dedicated partnership that we've set up in Cheshire for our public health work, which we've called the Cheshire Living More Dying More Partnership. And that ranges with representatives from all organisations and community members. So yes, we have health and social care reps on there, but we also have housing, fire, police, local businesses, church groups, community groups, and voluntary sector, so a whole raft of people within that partnership. And through that, it's identifying and enabling opportunities to work together. One of the examples that I can give you is that my team actually work with the public in terms of going out and delivering community sessions and skills workshops to equip people to talk about, think about, take action, as I've said, in relation to life, age, death and loss.
You don't need to work in health to be involved in public health. This is about public participation, and Dying Matters was expressly set up to try and bring in that huge raft of different people that Rachel's described. So within our membership nationally, there are funeral directors, there are solicitors and financial services organisations. So there's a real sense that this is part of a new global movement, and that in itself is really exciting.
As Simon said, it does feel like this is the start of kind of a global movement, a global social movement. And I think the fact that the international conference has grown each time that it's been held, so we're on the fourth conference now. The first international conference I went to was actually last year, and it's the energy there is fantastic, and getting to meet people, as Sam said, from across the world, and to look at the different interventions and initiatives and ideas. I think the fact that we're holding it in the UK is a really something we should be really proud of, and I think that hopefully we can encourage as many people to come, because it is one of those events that it really is inspiring and really does enthuse you, and just the passion that's there, it is tangible really. To see more people from public health, more people from the community, because as we've already discussed, this isn't just a health and social care issue, which is, people often think that is. I think it's really opening it up to the community, and anybody who wants to enable and empower people to live and age and die better should feel that they have something to offer and something to benefit from attending.
This is actually about really encouraging people to participate and saying, we know you're already doing this. What can we do to help? I'd really like to see a wide variety of people. I think there's a group of people who I'd like to come along who are already committed to end-of-life care, but people from NHS England, Public Health England, NHS Improving Quality. I'd really like to see people from local government, from health and wellbeing boards who've got a really important role in this, from the local government association, people working in social care and social services as well. But it's really important as well, going back to my point, that public health is not just about health, that we get other people there too, so that we get employers there, that we get schools there, or people who are responsible for education and educationalists, people who are responsible for curricula. It'd be really good to see people there, some of the large employment organisations, trade unions as well, pensioners groups and retirement organisations, those sorts of people. I think would be great. Financial services too. But people involved in the creative fields, because this is an area that we're seeing a lot more activity on at the moment. People really trying to engage with dying, death and bereavement and that bit of human experience. But there's still so much more that can be done.
Yes, to have that interaction between the kind of grassroots programs that are happening and the health organisations, as you say. Yeah, fantastic. Well, thank you so much. This is the first of a couple of conversations that I'll be having with people who are attending the conference and presenting at the conference. I'm really excited that we were the first to start this little series, and for everyone watching, the Public Health and Palliative Care Conference is May 13 to May 15. So hope to see some people who are listening in today there.